perfect position with your hips and knees flexed. What I'm going to look at is the amount of range of motion that she has in her trunk pelvic area. And so let's say that Heather is a right hemi. So what I'm going to do is I'm going to look at the amount of range of motion that she has by checking out her unaffected side first. So I'm going to bring her legs toward me. What I'm looking at is how much of a stretch am I getting in that area. Okay? I'm also feeling on the normal side, what's the ease of movement of doing that. Okay, so now then I'm going to look at the affected side. So I'm going to do the same thing and do it passively. And wow, I'm finding that she pretty much got the same range of motion, same ease of movement as I found on the other side. So what conclusion would I give?
She doesn't have any
normal tone. So then I'm done. I don't have to do any more. It takes a second or two to check. Then I move on and I go into treatment. Okay, so let's say that I check again. Okay, so this is her normal side. And now it just flops. I mean, there's no resistance. I get more range of motion on her affected side than I did on her unaffected. What am I going to say?
No treatment because she's
decreased tone. Okay, I move on. Now let's say that I'm checking her normal side. Now I'm checking her affected side, and ooh, that's about as far as it goes. Then I'm feeling some resistance there. That would give me an indication of what? Increased tone. Do I mobilize?
Yes.
Okay. One other thing that you may be thinking of with your patient is some of the older population may have normal decrease in range of motion. So you're checking their normal side and you may only get this far. And you're thinking, well, that's not normal range of motion, but probably for them it is. So you're not at this point thinking about increasing their range of motion on their unaffected side. You're just trying to compare the two sides. Okay? So take that into account. Okay, so we've determined she's got increased tone in her right trunk pelvic area. We need to mobilize. So let's position her. Now, in most cases in the clinic with your patient, you're not going to have them on a plinth. Okay? And again, we're probably talking pretty low-level patient, may not even be able to sit yet, because you try to have them sit, and, they're kind of over on their side and falling over a bit and not able to really elongate on that trunk, for weight shifting and so forth. So you probably not going to have them on this type of a surface. You probably have them on a mat that will be wider and in the gym and lower to the floor. So please be careful whether you're patient or whether you are the PTA helping, that the person doesn't roll off the plinth. Okay? So we're going to have to make some adjustments because of that. So I've got a pillow under her head. I'm going to take another pillow. I'm going to take this one's good. Okay. So we're going to be mobilizing then her right side. So what I'm going to have her do is have her roll over toward me. Well, she can roll because this is her good side. What I'm going to do is I'm going to place a pillow then underneath her trunk. Not underneath her butt, but underneath her trunk. Because the more that I can get assistance with positioning, the less work that I'm going to have to do. So go ahead and roll back. Now be very careful. She'll probably need help then rolling over toward this side because this is her affected side, okay? And I'm going to bring, you just so you don't fall off the table, okay? All right, and come in, lay down on your side. There you go. Take this off where I strangulate myself. Okay. So I want a pillow underneath her trunk, not underneath her butt. So I want to try to get some elongation there from the use of the pillow. Now I also want to put a pillow underneath her head. I want to have her take her hand out. What I want is the head to be in a neutral position. I don't want it to be side flexed toward her right side, which is her affected side, because that can increase her tone. So make sure that with your mock patient in your practicals that they don't fold up the pillow or they don't put their hand underneath so that then their head is up. Okay? Okay, so you're going to have to watch your patient's position. So we've got one pillow underneath the trunk. We've got one pillow underneath the head. Now for the lower extremities, we want to avoid the flexor synergy pattern and the extensor synergy pattern. So what we're going to do is position her kind of in between flexion and extension. So we're going to position her like this and just make it comfortable. Now, your patients, you want them to be relaxed. If they fall asleep, it's kind of a compliment that they're, just very relaxed. They don't feel any increased tone. And so if your patient falls asleep, that's fine. Okay, one more pillow. So with the pelvic mobilization, we're going to have 4 pillows. Because this is her affected upper extremity, I don't want her to be in too much flexion or too much extension. So I'm going to put a pillow here and just have her arm over the pillow. Okay? Yeah, avoid having the pillow come up and, suffocating them in the face. Okay? So, what I want you to do when you position your patient is I want you to take the time and I want you to look around at their position and see if they're in the position that you want them to be. So avoiding flexion or extension in the lower extremities, so it's kind of midway in between. The arm, avoiding complete extension or flexion. The head in a good neutral position. The pillow underneath the trunk, not underneath the butt. So now I've got her in a good position to do the mobilization. Okay? Now with mobilization, you've got one stabilizing hand, which doesn't do anything, and you've got one mobilizing hand. So my goal is to increase range of motion here, so that if then I was to do the testing and move her back and forth, rotate her legs from side to side, she'd have the same range on both sides. And also, if we're thinking about forward rotation of the pelvis, normal in gait, how much range of motion do we need? About 5 degrees. Okay, so we're not going to get a huge amount of range of motion. Okay? So my stabilizing hand goes on her scapula. Just rest there. I want to keep her scapula slightly protracted. And also, patients will have a tendency, particularly the first couple times you do this, to try to look back to see what you're doing, and you don't want them to roll back. Okay? So you just keep a hand there. Doesn't do anything, just rest there. This is the mobilizing hand, and the hand goes right on the iliac crest. There's just a nice little place for the hand to rest in there. Don't put your hand like this, because you don't want to mobilize just by trying to use your shoulder abductors. You're going to fatigue too quickly. So you want to put your hand going down toward her feet and slightly anterior. So that's going to be the movement that you're going to be mobilizing. So right here on the iliac crest, and if you find your hand is kind of rubbing up and over clothing, then you can remove the clothing. Sometimes patients will have a belt on, and so you may ask them to remove the belt, okay, if it's up around the iliac crest. But you want to keep your hand right in that area, right in that depression, right in there. So this hand does nothing. This hand does the movement. I'm going to use my body to mobilize her. So remember, nice, slow, even, continuous movement is going to mobilize. So you want to hold it for maybe 10 seconds or so, and then you don't pull it back, you just let it release. So can you see the movement that she's getting in that area? Okay. Nice and slow. Does it hurt? Now, how do I know when to stop? When I feel the release. Okay, so what you're going to find, we're working with normals, so you're going to see the normal movement. If you're working with a patient, you may not see any movement at all. You think, am I doing this right? they're just not moving. But you're going to find as you do this, that, whoa, I got increased range of motion. Once that happens, that's your release. And again, it's not going to be massive, but do it 1, maybe 2 more times, and then stop. Because if you do it more than that, you're actually going to cause decreased tone, and then you got the opposite problem. Okay? So you mobilize nice and slow, anterior, down toward the feet, not down into the mat. Do it until you feel the release. Do 1 or 2 more times, and then stop and go on to some type of functional part of the treatment. Okay? Any questions then?
So you won't feel the release every time you do it?
You should.
Oh, you should.
Yes. Now, it's a good question to bring up. If you see the patient early on, let's say this patient just had a stroke 3 or 4 days ago, and they're starting to get some spasticity, you will feel a release. And you're probably going to be doing this, and you maybe have to do it 5 times, and then you feel the release. If you, however, you get a patient that has been 4 months, and they've had the stroke, and now it's tighter, it may take a little bit longer. But you should keep going until you feel the release, unless it's getting to the point where you're spending, 20, 30, 40 minutes just doing the mobilization. That might be too excessive. Okay? Because you always do want to follow up your treatment with some functional activity. But in most cases, you should get that release and get that normal range of motion. Any other questions?
So you just keep pushing for 10 seconds and then release? And then